Good afternoon, everyone. Thank you very much for joining us today for our regular briefing regarding COVID-19. We have Dr. Tedros, WHO Director General, Dr. Mike Ryan, Executive Director of WHO Health Emergencies Programme, and our technical lead, Dr. Maria Van Kerkhove. For journalists dialing in by phone, it's *9 to get in line for questions. Those who are joining us via Zoom, it's clicking on raise hand. We also sent you today with our media advisory few links to documents issued by our regional offices regarding COVID-19. So we invite you to read that. Following this press briefing, we will have an audio file and the transcript the next day. I give the floor immediately to Dr. Tedros.
Thank you, Tariq. And good afternoon to everyone online and in the room, and hope you had a good weekend. The number of cases in China continues to decline, and yesterday China reported 206 cases of COVID-19 to WHO, the low since 22nd January. Only 8 cases were reported outside Hubei province yesterday. Outside China, a total of 8,739 cases of COVID-19 have been reported to WHO from 61 countries, with 127 deaths. In the last 24 hours, there were almost 9 times more cases reported outside China than inside China. The epidemics in the Republic of Korea, Italy, Iran, and Japan are our greatest concern. I would also like to inform you that a WHO team have arrived in Iran this afternoon to deliver supplies and support the government in the response. I would like to use this opportunity to thank and save lives. We appreciate that people are debating whether this is a pandemic or not. We're monitoring the situation every moment of every day and analyzing the data. I have said it before and I will say it again. WHO will not hesitate to describe this as a pandemic if that's what the evidence suggests. But we need the law since 22nd January. Only 8 cases were reported outside Hubei province yesterday. Outside China, a total of 8,739 cases of COVID-19 have been reported to WHO from 61 countries, with 127 deaths. In the last 24 hours, there were almost 9 times more cases reported outside China than inside China. The epidemics in the Republic of Korea, Italy, Iran, and Japan are our greatest concern. I would also like to inform you that a WHO team have arrived in Iran this afternoon to deliver supplies and support the government in the response. I would like to use this opportunity to thank Crown Prince Sheikh Mohammed bin Zayed Al Nahyan of the United Arab Emirates for his support in making this mission possible. Shukran jazilan, Crown Prince. A WHO staff member in our Iran country, of course, has now tested positive for COVID-19, and he has mild disease. The Republic of Korea has now reported more than 4,200 cases and 22 deaths, meaning it has more than half of all cases outside China. However, the cases in the Republic of Korea appear to be coming mostly from suspected cases from the 5 known clusters rather than the community. That's important because it indicates that surveillance measures are working and Korea's epidemic can still be contained. Knowing and understanding your epidemic is the first step to defeating it. Korea's situation also underlines that this is a unique virus with unique features. This virus is not influenza. We are in uncharted territory. We have never seen before a respiratory pathogen that's capable of community transmission, but at the same time, which can also be contained with the right measures. If this was an influenza epidemic, we would have expected to see widespread community transmission across the globe by now, and efforts to slow it down or contain it would not be feasible. But containment of COVID-19 is feasible and must remain the top priority for all countries. With early aggressive measures, countries can stop transmission and save lives. We appreciate that people are debating whether this is a pandemic or not. We're monitoring the situation every moment of every day and analyzing the data. I have said it before and I will say it again. WHO will not hesitate to describe this as a pandemic if that's what the evidence suggests. But we need to see this in perspective. Of the 88,913 cases reported globally so far, 90% are in China, mostly in one province. Of the 8,739 cases reported outside China, 81% are from 4 countries. Of the other 57 affected countries, 38 have reported 10 cases or less. 19 have reported only 1 case, and a good number of cases have already contained the virus and have not reported in the last 2 weeks. We know people are afraid. We know they have many concerns and questions. Is the virus spreading in my community? Will my kids be okay? Will my parents be okay? Is it safe to hold an event? Should I travel? The answers to these questions will vary depending on where you live, how old you are, and how healthy you are. Individuals, families, and communities should follow the advice provided by local health authorities and local health professionals. WHO will continue to provide evidence-based guidance to help countries and individuals to assess and manage their risk and make decisions. There is no one-size-fits-all approach. Different countries are in different scenarios. More than 130 countries have not detected any cases yet. Some just received their first cases yesterday. Some have clusters of cases transmission between family members and other close contacts. Some have rapidly expanding epidemics with signs of community transmission. And some have declining epidemics and have not reported a case for more than 2 weeks. I'll repeat this, and some have declining epidemics and have not reported a case for more than 2 weeks. Some countries have more than one of these scenarios at the same time. For example, China had community transmission in Wuhan, but relatively small numbers of cases in other provinces. Other countries have a similar pattern. WHO is advising countries on actions they can take for each of the 3 CIS scenarios. First case, first cluster, first evidence of community transmission. The basic actions in each scenario are the same, but the emphasis changes depending on which scenario a country is in. Our message to all countries is, this is not one-way street. We can push this virus back. Your actions now will determine the course of the outbreak in your country. There is no choice but act now. I thank you.
Thank you very much, Dr. Tedros. We will start first here in the room, and then we will go online. And I repeat again that we would like to have each journalist asking only one question. We will start with Shoko, please.
My name is Keja from Japan Broadcasting Corporation. The number of confirmed death cases has reached 3,000. Total number in the world, and the coronavirus has spread now to 65 countries. Are we still in the phase where we can contain the virus? Thank you.
I think your question may have been formulated before the Director General spoke. I think he was very clear on where we are. The fact remains that for most countries, the vast majority of countries, we don't have community-level transmission, or at least demonstrated in those countries. There is a very small number of countries in which we have demonstrated and established community transmission. That's not a good situation for those countries, and it's certainly not a good situation in terms of the impact on the health systems, and we've seen that, and the very unfortunate, regrettable and tragic deaths. But when we look at this at a global level, and we look at the number of countries affected, and of them, the number of countries who have established community transmission, we are still hopeful that containment is the right first strategy. But clearly, containment with the purpose of slowing down the virus. And if we're lucky and if we do the job really well, we may get the opportunity. We just might get the opportunity to interrupt transmission. But at the very minimum, containment is allowing us to significantly slow down the spread of the virus, thereby giving an opportunity for health systems to prepare, for PPE to be made available, for training to take place, for laboratories to get reagents, for laboratory technicians to be trained. So we still firmly believe that the strategy of containment with slowing down spread, with protecting the health system, is still the best combination or blend of strategies right now.
Yeah, I would like to add to that. In the statement I just made, I have tried to categorize the countries. And you can have a look for yourselves, by the way. Why we say containment works. One, a good number of countries, around 8, have actually not reported cases in the past 2 weeks, more than 2 weeks. Although they had cases before that, they had reported, and then they were able to contain it. But in addition to that, if you see what's happening in China, it shows from the result so far that this outbreak can actually be contained even where there are many cases. So it would be safe to assume that, especially in countries where they have less number of cases, it's even more possible to contain it. And from the 62 countries who have reported cases, 38 of them have reported 10 or less cases. Actually, 34 countries have reported less than 10 cases, and 4 countries 10, so that makes it 38 less or equal to 10 countries. These countries should really invest in containment. And of course, we're also saying at the same time, even if you have more cases, it could be thousands, like, for instance, Korea or China, or Italy, still containment is better. By the way, in Italy, we see that the Prime Minister is now coordinating the whole effort. The central government and also the local governments are aligned, and we can see a very clear political commitment, and surveillance is now boosted. Of course, they were surprised, but they have strong institutions. They're bringing it together, and we have confidence in Italy, and we believe that they can also contain it. So that's what we're saying. Containment is possible in all countries that are affected. And that should be number one. And then, of course, the other strategies can also be applied. And that's why also we're saying the comprehensive approach is very, very important. So, okay, giving the overall picture globally, like saying, okay, we are close to 90,000 and we have more than 3,000 deaths, 65 countries are affected, is fine. But at the same time, let's go down